Welcome to the Lifestyle PT Wellness Spotlight. Our goal is to connect you with local businesses and to assist you in living your best life. Now introducing your host, Dr. Karen Schuler.
Hi everyone, I am talking today with Angela Davandaza from Advanced Thermal Imaging in Lake Wylie, South Carolina. Angie, how are you doing today?
I am awesome this morning. How are you, Karen?
I'm doing great, and I am excited for our topic today on thermography or thermal imaging, whichever way you want to say it. They're the same thing, and I'm just excited for us to get into this topic and for our listeners to learn more about it. And very much excited that we have this here in Lake Wylie, South Carolina. You don't have to cross the bridge to get it. But before we get into what thermal imaging is, for those who are listening who maybe don't know who you are or that even your business is here in Lake Wylie, can you tell us a little bit about yourself and your business?
Yes, I would love to. My name, as you mentioned, is Angela Davandanza, and I've been in Lake Wylie, Clover area for about 20 years. I've raised my children here. I love this community. I consider it my hometown at this point. So when I discovered thermal imaging for my own personal journey, I knew that I wanted to bring this to my community. I wanted it to be accessible right around the corner. And like you said, not have to cross the bridge to get to this amazing technology.
Well, Angela, let's go ahead and get into actually what thermal imaging is. So what is
Thermal imaging, yes, we use a specialized camera, a military grade camera, to detect heat in your body. Every person has their own unique thermal fingerprint. Your fingerprint is unique to you. Your thermal fingerprint is unique to you. So my camera picks up on the heat. We don't have to touch the body. We don't have to use radiation. It's been FDA approved since this particular camera, FDA approved since about 1982. So we're just picking up on heat. We're picking up on heat differentials. Your body should be symmetrical. So if we find like a hot spot on the left side, we know something's going on there. So it helps alert us to hot spots in our body that we may not even be aware of yet.
I'm surprised to hear that it's been around since did you say 82?
Yes, this camera that I'm using has been FDA approved for breast cancer risk screening, vascular metabolism, all kinds of stuff since 1982, yes.
So this is not new technology.
No, it's not new technology. It's actually been around for quite some time. It's been used for clinical medical for quite some time. It's just making its way over to the East Coast. It's wildly popular in California. They're seeing in their studios about 200 patients a month. So it's very popular in California.
Yeah, that is surprising. I know I've heard about thermal imaging back in about 2016. So I did not realize that it had been around that long. So this is something that has truly been tested. As you said, it's FDA approved, which that means that it has to undergo the scrutiny and prove that it does what it says it does.
Absolutely. And I do have that FDA document on my website. So if someone's curious about what does an FDA document look like for this camera, you can go to my website under frequently asked questions and see the camera and actually see the FDA document.
That's great. Well, what type of scans do you do? Are you doing just the whole body? Do you do an arm, a leg? What does that look like?
We do everything. We really are focusing on women's health, and so our breast scan is kind of what we're focusing on. This camera was FDA approved for breast cancer risk screening. Okay, and so my camera can look at, in the breast area, it can look at your metabolism, it can look at your estrogen that's recirculating. We can see the vascular changes in your breast tissue. So we really can get an inside look to the physiology, the things that are moving in our body, and we can see if there is dis-ease, if there's some heat, some thermal heat that's causing dis-ease in our body before it actually becomes a tumor. So we can do breast scans. This is kind of what we specialize in. but we know that our body is all connected, right? Elbows connected to the shoulder bone, so we do full body scans. We understand that a lot of the lymphatic that shows on our camera can flow from the face down through the neck and down into the breast tissue. So a full body really helps show where the root cause, right? Speaking of root, you might have like a root canal that isn't giving you any issues, okay? You're not having any pain, no issues, but you're asymptomatic, but maybe it's compromised and it's leaching into your lymphatic system and then trickling down into your breast tissue. So a full body will help us really look at where this inflammation is coming from, and identify the root cause to whatever's going on in your body. So we do full body scans, which is about 36 pictures, and we do breast scans, which is about 8 pictures. We can do region of interest. I had a lady come in. She was looking for a second opinion. A doctor said, we're going to do a hysterectomy. She wasn't convinced that it was her reproductive system. So she came to me and she said, tell me what your thermal imaging camera shows. Where's the heat? And my camera showed that it was in her reproductive system, but like she thought, there was some gastro issues going on also. So this helped her doctor realize that both of these two may be working together, the gastro issues, the reproductive issues. So it's a tool to aid in even your doctor's diagnosis and treatment plans for people.
So what you're saying is, like, if you just do a breast scan, but yet the root canal is the root cause of what's going on, you could be treating the inflammation in the breast and missing what's actually causing that inflammation.
Absolutely. Absolutely.
So if you do a full body scan, is that detailed enough for the breast, or do you need both?
It is detailed enough for the breast. The breast is the most detailed report that you're going to get, okay? Because we're talking about breast cancer. We do know, this is important to say, the only way to truly diagnose cancer is a biopsy, right? Thermal imaging is a tool that we can pick up on the heat and know that something's going on there, so we can address that with different modalities, supplements, whatever we want to try. But the specialized report is the breast report. The other report it's certified by the doctor who diagnoses pathology. Okay, so he understands pathology, and he's the one that does the full body scan. He reads the full body scan. So it just helps you understand how everything plays together. Like you can have sinus issues that are dumping down into your lymphatic system, so it doesn't necessarily have to be a root canal. It could be sinus issues, TMJ, we can pick up on anything that produces heat in the body.
Now, does this replace getting a mammogram?
That is an awesome question. No, it does not replace a mammogram. They are totally different. I love to explain to people the difference in a mammogram and a thermography. Mammogram is looking for structure. It's looking for something that has already formed inside your body. Okay, so there's an importance there. If someone has gone and they've never done any diagnostic work, and that mammogram is going to come in and say, there's a tumor there. We need to investigate this further with a biopsy or whatever. Thermography is looking at the physiology of the body, the things that move. Think of it as you're opening the hood and you're looking under the hood of your car. You're looking at the fluids, you're looking at the oil, you're looking at the things that cause that car to run. Okay, and so they're totally different. They can complement each other, but they are very different. Thermography is looking for heat. Scientifically, it takes about 7 years for a tumor to form. And we're looking at that physiology over that 7-year time frame that's forming that tumor. And we're going to try to get in there with some prevention, right? We understand that environmental plays a huge part in our breast health, in our overall health. So if we notice that maybe your breast from your thermography shows too much estrogen, we're going to work towards fixing that. Say we have too much vascularity, we're going to work towards fixing that before we actually have a tumor. Okay, so we're kind of coming in on the front end and trying to prevent that tumor from forming by changing the environment in our breast health. Does that make
So
sense?
on your scan, when you're seeing heat,
Mhm.
are you seeing inflammation, or like you were saying, you can tell if there's too much estrogen? Is that based upon the heat, or are there other factors that tell you, that are clues that there's too much estrogen in your system?
The heat alerts us to say, hey, what's going on here? And then we're looking at the vascular patterns, we're looking at the whole breast tissue, we're looking at the lymphatic system that dumps right into the breast tissue. So yes to that question.
Yeah, and I could say with some other alternative treatments that I have personally used in frequency medicine, this is very consistent with what they teach as well, which means that it takes 7 years, for things to present themselves. Like you were saying, it takes 7 years before the tumor is actually formed. So to me, this is very exciting that you could get in there ahead of time and kind of see that you're headed down this road, towards the cancer or towards a tumor formation, and try to do something about it before you reach that point. So that's very exciting. I know from my education, an inflamed cell is what then transitions eventually into a cancer cell. So controlling inflammation is very important. But they call it the silent killer because it's hard to see. So this actually gives us a window into the body so that we can see it. Am I understanding that correctly?
That is exactly how it is. It is a window into the body so we can see the inflammation. Yep. And treat it before it becomes a disease.
That's very exciting. I know I'm always, an ounce of prevention is a pound of cure. If we can see something ahead of time and save us the heartache and the money that it costs to treat cancer. Well, let's talk a little bit about, how did you personally get involved with doing thermal imaging?
About, 2016, 2017, I started feeling not quite myself. I didn't have the energy that I was used to. I'm raising a house full of kids, and so my energy needs to stay up. My sleep needs to be good. I need to be, an effective machine running. And I wasn't feeling great. I went to my doctor, of course, and had all my blood work done, and they're like, you're perfectly fine. I knew I wasn't perfectly fine. So I've always been into natural wellness, holistic care. So I did a little research. I'm not about radiation on my body. I wanted something really natural, but a good look into what was going on, something different. So I crossed the bridge and left South Carolina, headed towards Charlotte, went to South Park, and visited a thermography center, and had a full body scan and realized that my lymphatic system was not operating optimally. And, a lot of us aren't aware of how our lymphatic system works. It's kind of like the little trash collector. So if the trash collector is congested or stagnant, things aren't moving properly. So I discovered that. I didn't even really think about my lymphatic system in my health and wellness journey, but the thermography woke me up to that. Started doing lymphatic drainage, dry brushing, just all the natural things to change the environment of, my health. Went back a year later, and it wasn't improving as much as I would have liked. So I just kept with the treatments, kept doing that. In 2019, I'm all about the FDA, see what they have to say. So I read a lot of articles. I'm always researching. And on February 9th, 2019, the FDA came out with an article that said breast implants can cause lymphatic cancer.
I've never heard that.
Yep, it's an FDA 2019, February 9th. They came out with the article. I stopped in my tracks. I was like, wait a minute. If the FDA is saying this, probably can trust it. They're going to have enough articles to say, you know, this is doing this and enough studies to prove it. So I kind of had a feeling this is what was going on with me, all this lymphatic issue that I wasn't able to resolve. And so within a couple weeks, I scheduled surgery for myself and had my implants removed March 25th, 2019. So literally within a couple weeks. And the very next day, I could feel the difference in my body. I had oil production in my face again. I could actually fold an entire load of laundry without my arms getting tired. My sleep was peaceful and restful. Just so many things. And I was like, can this be true? You know, we've turned the corner here because this thermography made us aware of what was going on. We used it with modern Western medicine also, right? We did go to a doctor and have that surgery done. So holistic and Western can kind of work together. So
That's amazing. I mean, and I know no greater validation than personal experience. You know, we definitely have the science behind it because we've got the FDA recommendation from it, you know, but to have a personal experience and a personal journey just makes it even more valid in my opinion. So you were able to see, you know, that you had heat in your body, but the root cause were the breast implants.
Absolutely. Absolutely. And
that's amazing. I mean, because you could spend, you know, so much time and so much money just trying to search what's wrong, why you're not feeling well. And yet the root cause was the breast implants. So,
yeah, absolutely. And I'm healthier now than I was 20 years ago. You know, I have so much energy. I'm feeling amazing. My hair is growing back. You know, I'm opening a small business, bringing this technology to my community. I'm just so excited, you know.
And for that, I would say you're an inspiration to all the young women out there who are maybe raising their kids right now and wondering if they can do something later in life. And you can, you know, I've raised 3 boys myself and I'm 52 and, you know, you can't do it all at one time, but you can do it all over, you know, a large amount of time. So, you know, kudos to you for just continuing on and taking your experience and helping others with that experience.
Yeah, thank you. Thank you. I do have one more personal story with thermography I do want to share with you real quick. Recently, actually, since I've opened my studio, I went and got more blood work done, right? Because we go to our doctors for this blood work. And I was checking my thyroid this time. And, you know, my doctor said, your thyroid is perfectly fine. Again, you know, we know our bodies better than anyone. We need to trust ourselves and our bodies. And I knew something was off as far as weight loss and things like that with my thyroid. So I put myself in front of my camera. I had one of my other technicians come in and do a shoot just to see what was going on. And it came back. I was waiting for a thyroid, you know, scan to come back abnormal. I couldn't wait to see one of these. Well, guess whose it was? It was mine. It was mine. It was mine, which is very cool because I could share the experience without, you know, a HIPAA compliance. You know, I can share that. I got the report that said my thyroid is cooling, right? So he knows. Yeah, he knows what temperature our body's supposed to be. And my thyroid was actually cooler than it should be. So what does that say to me? According to my blood work, I'm fine. I caught this before it's diseased, right? I don't need medication. I can use iodine, right? It's a natural element that we get from seaweed to encourage my thyroid to do what it's supposed to do. We don't get thyroid in our diet. You know, not a lot of us are eating seaweed and these kind of things. So I adjusted my diet. My thyroid is perfectly normal now. So there's an example of how we can, you know, when we feel that dis-ease in our body, get in front of a camera, let it guide us in what does our body need right now, right? And so right now I needed a little bit of extra iodine in my diet.
So, and you said at that time it was a cooling signal, not a heat signal. So,
Mhm.
so it's not just about heat. It can be cooling as well.
Absolutely. Absolutely. Mhm.
Well, to me, this is just an amazing piece of technology. You spoke about that an MD does the report. How long does it take to get that report?
It takes about 5 business days. Our reports are read through the International Academy of Clinical Thermography. So he's reading reports all around the world. He does ask for 5 days from the day that I submit it to him before your report comes back. When I receive your report from the doctor, I will call you, let you know that the report has been received, that I'll be emailing it to you, let you know that I'm here for you if you have any questions. Another reason I hired the International Academy of Clinical Thermography, if you, Karen, say you come in and you get a report done and you have a question that I can't answer for you because I'm not a doctor, you can call this doctor on the phone and he will discuss it with you.
Oh, wow.
Yes, he's available to my clients for a call if they have a question or something like that. So he's accessible.
So there's another person to add to your team to help with figuring out the puzzle.
And he's the only doctor that can read our thermography is a doctor that is certified in diagnosing pathology. Okay, so I'm not reading these scans. These scans are being read by a doctor that's able to diagnose pathology. I know there are some competitors out there, they read their own thermograms. Since we're clinical medical, it needs to be read by a doctor, in my opinion.
Okay. That's a very good distinction to make. Also, when you were talking about kind of some differences among competitors, the type of camera that you use, is that important, or are all cameras created equal?
That's a great question. No, all cameras are not created equal. I did a lot of research before I bought my camera, and I wanted the best of the best. And that's what caused me to end up with the camera that was actually certified for FDA approval. There are other cameras out there that use this technology, but their camera is not the camera that was certified for FDA approval. Cameras can do 310,000 megapixels. My camera is 610,000 megapixels.
Oh, wow.
Yeah. So the camera does matter, and the doctor reading the report, both of those, very important.
That is an important distinction to make, because if, not saying that other cameras don't work, but it hasn't gone through the scrutiny that the FDA puts you through to prove so that you can trust the results that you're getting.
Absolutely.
And I love the examples that you gave too on how you utilized it to then help you to treat, to work with your physicians so that you could properly treat yourself and to basically help yourself heal and get your energy and, life back. So that's exciting.
Yeah.
Let's talk a little bit about what a typical appointment at your facility looks like.
Okay, that's a great question. We will have you fill out some paperwork. Ideally, fill it out before you come in because, we want to use your time wisely once you're in the studio. So we have some paperwork that goes straight to the doctor. He wants to understand everything that you've been going on, that's been going on in your body that led you to get thermography. You'll come in the studio and it's a scientific situation, right? Your body is roughly 98.7. My studio is exactly 69 degrees. What this does is it causes a chemical reaction. So you're going to come in, you're going to disrobe down to your birthday suit. We have a screen in the room to assist for modesty. And you're going to sit there, watch a little video. I have a little 13-minute video. You have to acclimate for 15 minutes. It takes your body 15 minutes to enter a resting state, which means your body has acclimated to the room and your body is actually emitting your heat in a perfect situation. Okay, so I'm going to put you in front of the camera. For a breast scan, we're going to do about 8 pictures Takes about from beginning to end 30 minutes for a breast scan.
That's not bad.
No, 15 minutes acclimating to the room, 15 minutes to take the pictures. And then that's pretty much it. If you're there for a full body, that's going to take 30 to 45 minutes. Again, that 15 minutes acclimating to the room. We take about 36 pictures. We get every angle of your body. We don't want to miss anything. So about 36 pictures.
Well, I think that sounds very reasonable. You know, if people want to get in touch with you and to make an appointment, or even just to learn more about thermal imaging, how can they get more information?
We are located, I have a studio in Dragonfly Wellness Center. So we're in a wellness center. You can stop by. I'm there most of the time during their business hours, except when I'm doing podcasts and marketing and things like that. I love to be in the studio when the hours are open to greet people, let them see the studio, and go over, you know, what we do in there. So you can check out my website. There's videos on there that talk about breast health. You can stop in the studio. You can call me.
So go ahead and give us a phone number and give us your website.
My number to reach me at my studio is 803-610-2435. And my website is www.advancedthermalimages.com. Videos, information, you know, that'll get you going for a while on that website.
That's great. And what kind of pricing could we expect for a body scan or a breast scan?
Okay, that's a great question. I really wanted to keep my prices where anybody could come. I didn't want this to price people out, right? I wanted it to be affordable to everyone. So my breast scan is $150. I think my competitor is about $285 on her breast scan. So I'm really keeping my price. You know, I want to be here for my community. Want to make it affordable. I didn't want it to keep anyone from being able to access this technology. So a breast scan is $150. Half body is $250. Okay. And then a full body is $350. We can do region of interest if we need to, like, you know, we're working on a second opinion or we're checking a treatment to see if it's working. We can do region of interest, and that's $150 also.
Okay, that does answer a part of a question for me. If you get a scan, when do you recommend do you recommend a second scan, and when do you recommend that second scan?
My doctor that interprets the report, he's going to recommend when you need to come back for a scan. So okay. I'm seeing some people that have more issues going on, more heat, more vascularity. He wants to see them in 3 months. People with no estrogen, no vascularity, and there are those people out there that have perfect breast health. He'll see them, not as many as we would hope. We're moving in that direction, but he'll see them every year. So when your report comes back, the doctor has specified when he'd like to see another thermogram. So it could be 3 months, it could be 6, it could be a year. So he's the one that decides when he needs to see a scan again.
Okay. Well, great. Well, Angela, it has just been really great to have you here today and to really gain a lot more insight into what thermal imaging is and how it can prevent so many future diseases, you know, for our body. I know I'm excited at Lifestyle Physical Therapy. I think we're going to be able to partner with you and actually even be more specific with some of our patients and some of the treatments that we do. Mm-hmm. So welcome to Lake Wylie. I'm excited that you're here, and just thank you so much for being on the show today. And, you know, for those of you who do want to learn more information, please check out Angela's website or give her a call on the phone. She'll be happy to speak with you.
Yes, I will. And it's been wonderful to talk to you this morning, Karen. Thank you very much.
Thank you. I hope you have a great day.
Thank you.
Thank you for joining us today, and we hope you enjoyed this podcast. Make sure to like us on Facebook at Lifestyle Physical Therapy LLC and on Instagram and Twitter at Lifestyle PT2. Until next time, stay connected and be well.